What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason, probably not going to change. Fan question asking for some tips or suggestions for a new nurse starting in the ICU. Brand new, green behind the ears, new grad, going right in the ICU. First of all, congrats. Welcome to the family. I got 5 things that might help you when you're first starting out in the ICU. 5 simple things you can think about that you can do immediately. 5 things that I think you should concentrate on outside of learning your new job. Number 1, get a notebook. Some sort of miniature notebook. They have the little fat notebooks. They actually call them that, little fat notebooks. You can get one of those or a 5x7 type of notebook. And you need to start writing down all of the important things that you're going to have a tough time remembering. Lab work, lab values, procedures for drawing labs, hemodynamic parameters, hemodynamic procedures, how to set up an A-line, CVP, ICP. The list is endless. You eventually won't need the notebook, but you should use the notebook in the immediate, during that first 3, 6, 9, 12 months. Trust me, you're going to use it a lot. Number 2, brush up on your math skills. I don't care what math you did or did not do in school. I don't care what math you did prior. You're going to need to know your math. You're going to need to know weight-based infusion formulas. You're going to need to know how to convert things, and you need to know how to do those relatively easy. You can't go referring to a book or a table or the internet or keep looking on your phone. Granted, if it's an interesting heparin infusion kind of formula that you have to multiply with odd numbers, sure. But you should not be using your phone every single time you need to calculate a drip rate. Number 3, develop that thick set of skin that I always talk about and learn to stand your ground. Even when your voice is shaking, stand your ground. Stand your ground to the docs, stand your ground to the providers, stand your ground to the seasoned nurses, stand your ground even to the new nurses. It's time to stake your claim in this profession. I will caution you, earn it before you demand it. Earn your respect before you demand your respect. You need to prove yourself to your coworkers and your colleagues. They need to know they can trust you. Number 4, look for some good resource books. Everything from the little bedside resource books to, quite honestly, the nursing, critical care nursing made incredibly easy. Resource books that you can look at when you're not at the bedside, as well as books you can have while you're at the bedside. And trust me, those resource books are going to become the close sister of that notebook that I talked about. Number 5, I want you to start getting comfortable with ventilators on day 1. Start asking questions so that you understand. If you are unfamiliar with anything about the ventilator, ask questions. Talk to the respiratory therapist. For those of you who haven't watched my video on respiratory therapists, you need to go watch that. Talk to your respiratory therapist. They are an invaluable resource when it comes to all things about the ventilator. Whenever somebody is in front of a ventilator, you are taking care of a patient who is on a ventilator, and someone steps foot in front of a ventilator to mess with it, change something, ask questions, hover, find out what they're doing. Even though you don't understand it just yet, start asking questions now. You need to get comfortable with working with mechanical ventilators from day 1. 5 quick things I think about with the new nurse in the ICU. Quick, down and dirty, nothing spectacular. Hope it helps. What do you have to offer to this new nurse embarking in the ICU? Inquiring minds want to know. Leave a comment down below. Leave some words of wisdom for this nurse as well as the other nurses that will be following in their footsteps. Your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.